Hello everyone and welcome to the Part D Search and Enroll tutorial on how to use our system here to search for your Part D drug plan. You'll be first looking at this screen where you'll have a couple of different things going on. This red urgent lettering here is important. You want to watch this video first before you move on to shopping and enrolling into a plan. It's important to watch this video because this video is going to talk about how to search your plan and enter in your prescription medications, so it will automatically populate which prescription drug plan is going to be the best one for you. So again, before you do anything, you're going to want to click this play button here and watch the video. What will happen is it'll pop it up here for you to look at, and you'll be able to see exactly me going through an example of shopping your drug plan. Once you've completed that, you can then come down here to this green button if you're looking for the plans in 2022. So if you're looking for a new plan for the beginning of January, you'll be clicking this green button. If you are just aging into Medicare for the first time and you still need a plan for 2021, you can utilize the red button. For the most of you that are watching this, you will be wanting to click on the green button to view the 2022 plans, and that will automatically pop up the next screen for you, which will be this, and this is where you are right now in the video. When you're ready to shop the Part D prescription drug plan by clicking that link, it will bring you to this screen here. And I want you to notice, you'll see it should say Agent Joseph, myself, my contact information if you have any questions at all. And you have this login button here. Now you could always just go right to the plans and type in your zip code. I always recommend creating an account. When you create an account, this will then save your prescription drug list, so that way next year when you need to shop it again, you can just make the minor adjustments that you need to, as opposed to retyping in all of your prescription drugs every single year. So you type in first name, last name, zip code, email, create a password, and then it will create an account for you on our Part D search here. And that way, next year, you'll be able to just sign on in and make a few edits. Again, you can just go right to view plans if you want to see what's available in your zip code. I do not recommend doing that. I recommend going down here to where it says edit your preferences and clicking on that button first. Here you can then type in your zip code. Let's just use a generic zip code. We'll say in Chesterfield, Richmond, Virginia area. And you're going to see here medical only, prescription drugs, medical and prescription drug coverage. This medical only is for a Medicare Advantage plan. Prescription drug is the one we want to click on if we're looking to shop the prescription drug policy. Once you click on prescription drug, it's going to ask you if you receive any additional benefits. This is an optional button here. You do not need to click anything. Make sure prescription drug is clicked off, and then you can hit continue. When you hit continue, it's going to bring you to this screen here that says prescriptions. And you're able to add each prescription that you're taking. Again, what's going to happen here is this Part D search system is going to go through all of the formularies to see which plan handles your prescription medications the best. So let's add a few in here, some common ones. Amlodipine, Besylate. And I want you to notice when we type in the medication, it pre-populated that there, and you're able to click on the one that you wanted. Now, it's important that you look here. You're able to select the dose and form of the medication you want. So if we have a 5 milligram tab, here is the quantity section where you're able to choose how many pills you're getting each month. You can change this to per month, 2 months, every 3 months on a quarter basis. I recommend if it's a regular medication, just keeping it as a per month frequency. It's gonna show the results better that way. Even if you do a 90-day mail order supply, it will just automatically update that for you. So let's say we take 30 pills every month. We're going to click this yellow add button. And then let's type in another one. We'll say metformin. And here you're able to see there's a couple of different options. So we have the 500 milligram tab, but we also have the 500 milligram ER tab. So it's important when you're going through your prescription drugs that you are picking the one that you're actually taking. So whatever it says on your prescription bottle is the one you're going to want to pick. Let's say we're not on the ER, we're just on the regular one. And here we take 2 pills per day. So we're taking 60, we're getting 60 pills every month. We're going to hit add. And then let's add another one in here. Let's say rosuvastatin. Same thing, 10 milligrams, 30 per month. We're taking 1 per day. Great. And then let's put in, let's say montelukast sodium. So here is where you'll notice that there's a couple of different options. You have a tab, you have a chewable, and then a granule, I suppose. So here, we're gonna say we're taking the tab. Again, you wanna make sure this is the type of, or the form of medication you're taking. So whether it's a tab, might say capsule, might say chewable, solution, you wanna make sure you're picking the right form of the medication as well. So we got these 4 added in here, and this is, let's say this is all 4 that we're taking on a regular basis. We're gonna hit continue. Here is where you're able to add a pharmacy, a preferred pharmacy. I don't want you to do that now because I want you to run the plans without choosing a pharmacy. Sometimes there can be a large discrepancy in cost per year for having all of your medications at one pharmacy. If we leave this blank, what will happen, it's going to sort the plans based on your actual drugs that you're taking. And then we can always add at the end, we can see which pharmacies are considered preferred and in the network. So we're going to leave this one blank. We're just going to hit continue here. We're also going to click continue on other preferences. And that will end up displaying the plans. Now you're going to see here that there are 4 tabs that are at the top. It's very important that you are under the prescription drug plan tab. As you can see, there's Medicare Advantage prescription drug plans, Medicare Advantage plans, Medicare supplement plans. It's important that you're looking at this tab here, and you'll notice that by the first one listed as PDP. If you are under the MAPD section, you will mistakenly enroll in a Medicare Advantage plan, and that will therefore kick you off of Medicare. So very important that we're under the prescription drug plans tab. Now you're going to notice as you scroll through, there are a number of different carriers and plans that are here. You will also notice that not all of the carriers that are on the Medicare.gov website are listed on our Part D search website, and that is done on purpose. We feel that our clients should be working with companies that we're confident in, that have had experience with the Part D prescription drug plans, and not just a new company that's starting out for the first year with their prescription drug policy. We don't want our clients to be the test dummies on those policies. We'd rather see some experience and have confidence in the company first and foremost. So there's a lot of numbers as you can see here. I want you to sort this on the tab here. It's going to start by preference score, high to low. And that's great. You can look at it that way, but I want you to sort it by total estimated cost. And it should be fairly similar, but as long as you change that to total estimated cost, it's going to give us a snapshot figure of what we can anticipate for the calendar year. Now, as you can see, there's a number of different things here that we're looking at. First and foremost, the monthly premium. This is what you'd be paying every month for the Part D prescription drug plan. We see the second most important thing is that on this highlighted area where it says prescriptions, that all of our medications are covered. 4 of 4. The 4 that we entered are covered by the plan. We're going to come back and touch on the deductible in just a second here. It applies to certain medications and it doesn't apply to others. I'm going to show you that in just a second and how you can find that out. Estimated drug costs. So this is what we can anticipate paying as far as co-payments go or possibly deductibles for our medications for the whole year. And then this right-hand corner here where it says total estimated annual cost, what this actually is doing is it's projecting the cost of this drug plan for you for the whole calendar year. So it's taking your premium for 12 months if you're starting in January, and it is also taking the cost of all of your medications that you're going to have for the year, co-payments, etc., and it's giving you a one snapshot annual figure of what you can anticipate paying for the year on this plan. As you can see, we have sorted it by total estimated cost. So as you scroll down, you will notice that that total annual estimated cost starts to get larger and larger plan to plan. So how do we know, what our medications are doing, what pharmacies are covered by the plan, etc.? We go to plan details. So if you want to check out the plan and how it's actually going to handle your medications, we would click on plan details. And that's going to give us more of a summary on how the plan is working. The first thing that I want you to notice is I want you to notice the annual prescription deductible. So remember that $480 figure that we had saw there. As you can see here, it's a $0 deductible on all tier 1 medications with this plan. The $480 deductible only applies to tier 2, 3, 4, and 5. Does not apply to any tier 1 medications. And that brings me to my next point, how we can see what medications are what tier. We're going to come over to this tab where it says prescriptions, and we'll click on prescriptions. And then as we look here, it's going to tier our medications by a category. So all tier 1 medications will be listed under the tier 1 preferred drug section, which all 4 of ours fall into. And if you had any other tier medications, they'd be listed under their section. So for the 4 medications we entered in, they're all tier 1 prescription drugs. So as you can see here, it's going to show you how the plan's going to work. Essentially, it'll have the retail cost of the medication if you were to pay out of pocket for it. And then it will have your cost before the gap. Before the gap is going to be what you're going to pay for this medication before you were to enter your coverage gap, or what used to be known as the donut hole. On this plan, all of these prescriptions would be $1 copay per month. Again, per month is what we're looking at. So if you're doing a 90-day order, obviously this times 3 would be the cost for your medication on a quarterly basis. Now, we're not taking enough medications where it's going to affect the coverage gap or the deductible, and I'm going to come back to that and show you how that would work for some higher end medications in just a second. Before I get to that, I'm going to go over this total estimated cost tab, because what this is going to show you is going to show you how your medications work each month by filling them. So it'll really show you a breakdown of plan premium, the drug costs, which each would have $1 copay. They do not apply to the deductible because they're tier 1. Remember, on this plan, there's no deductible for tier 1 medications. And it'll show you what the total monthly cost would be with your premium plus the copays that you would be paying. We said we were going to come back to the pharmacy and see, well, which pharmacies are going to work best for my plan. I had you leave that blank. So I want you to click back to the plan details tab. And if we scroll down to the bottom of this section here, we're going to see it says pharmacy, and it's going to say pharmacy directory. When we click this button, pharmacy directory, it's going to show us which pharmacy is considered preferred and which ones are considered standard. Now, standard pharmacies in the blue, as you'll see here, you can use, but you're going to pay a higher cost for your medications. So it's important when you're searching this that we're looking at the green pharmacy to see which pharmacies we can use with this specific plan, the SilverScript Smart RX plan. So we have CVS, we have Publix, we have Walmart in this one, Kroger. So as you can see, this is where you'll be able to see which pharmacies take the plan. And you don't have to just use just one. You can use any of them if they're a preferred pharmacy and in the network that they will work with the plan as it showed before. Now I'm going to pause this here and come back in just a second. What I'm going to do is I'm going to go back to so this opened a new tab. We're going to go back to the actual plan, which was the tab before at the top here. And this was the plan that we were looking at, the SilverScript Smart RX plan. If we go back and we hit previous, this is going to take us back to all of the prescription drug plans that were listed there. And I'm going to add in a couple of medications to show you how it'll work. There's an edit section here where you can come in and you can edit your medications right on the left-hand side of this section here. And we're going to edit in some prescription drugs. So we'll hit the edit section and we're going to add in maybe Eliquis. So that's a name brand drug. So this is going to work a little bit different with the plan. Let's say we're taking 2 pills per month. We're going to add in maybe another diabetic medication, pioglitazone. We'll get that one added in. We're taking a tab, 30 milligrams once per month. We're going to add that in. And now that we've added in a couple more medications, if we go back, we can hit continue again. Always hit continue when you're trying to go forward here. We're going to leave the pharmacy section with nothing in there. Again, we're just going to search it normally without the pharmacy listed because it's going to show you the lowest cost. We'll hit continue again on other preferences. And now it's going to bring us back to the plans and show us which one's the best for the specific drugs we're taking. Remember, we added those 2 in there, Eliquis and pioglitazone now. Again, the tab, we're going to come to total estimated cost. Make sure that that is sorted that way. And now, as you can see, the plans have changed around a little bit. Where the SilverScript Plus plan, the SilverScript Smart plan was the first one listed here. This has the WellCare ValueScript plan. So as you can see, same concept. It'll have the premium here. It'll have your 6 of 6 medications covered. Make sure that they're all covered by the plan. But now we also have a higher estimated drug cost, and that's because of the brand name medication we just added in, Eliquis. So it'll have your cost for the year here listed. It'll have your total annual estimated cost for the whole year listed here on the right. Now, if you look at these 2 top plans, I want to point something out. When you have a high-end prescription drug, you can notice that you'll have a low premium here option, but you'll have a $480 deductible, which will apply now to that higher tier medication. I will show you that in a second. But then you also have a higher premium plan that you could pick. By paying a little bit more per month, you could get rid of that prescription drug deductible. So as you can see, the estimated drug cost on this plan is $934. So you're paying out $934 for your medications on this plan, but it has a higher premium per month. This one, you're paying out $1,400 for the year, but it has a lower premium. So that always comes back to the estimated total annual cost. For some folks, it might be difficult to have that deductible at the beginning of the year, and you might be better off paying a little bit more in the premium per month to avoid that out-of-pocket cost. Let me show you what I mean by that. If we click on this plan here and we go to plan details to learn more about it, as this loads, we're going to go to the prescriptions so we can see what tier they are. And actually, let me go back here. What we're going to do is we're going to look at this here and we're going to see that it says that there's a $0 deductible on this plan on tiers 1 and 2. The $480 deductible is only on tier 3, 4, and 5. So again, this is where you can see where your deductible applies. If we click on the prescription tab, as you can see, the prescription drugs will be tiered here. You can see your tier 1s, preferred generic. Tier 2 would be a generic drug. Preferred brand would be a tier 3 drug. I don't want you to worry about this so much looking for the cost of the medication. The best way to see the cost of what your medications will be monthly will be if you hit total estimated costs. And that's going to bring us to this tab. And as you can see with this plan, we did have a tier 3 medication that applied to that deductible. And that deductible had cost $480 for the year. So as you can see with this plan, if we chose this plan, some of our medications would be free. One would have a $4 copay, which doesn't go towards the deductible. But then you have this high cost here of $522. The reason is Eliquis, being a tier 3 medication, would require the deductible to be paid first, and then the cost of the copay would come into play. So as you can see, in January with this plan, it's going to cost quite a bit of money to fill that Eliquis. But then if we look at February, once that deductible is satisfied, now it's just a copay that we're paying for that Eliquis at $42. And that will continue for a few months. And then with this plan, sometime in September, it looks like, is when we're going to enter into the coverage gap, or the donut hole, if you will. And this is where you're now paying a percentage of the medication as opposed to just a copay. The percentage while in the coverage gap is 25% of the cost of the medication. So as you can see, now some of these free drugs, there is a little bit of a cost to them now. And the Eliquis is now, as opposed to $42 a month, $132 a month while in the coverage gap or in the donut hole. That will continue, it looks like, for the rest of the year with this plan, because this person would not be filling enough medications to get out of the donut hole to the point of where the plan would then change again. So in comparison, if we go back to the list of plans by clicking previous, that'll bring you back to the main list of plans. If we look at the SilverScript Plus plan details, which has a higher premium of $62.40, and we go to total estimated cost, this one does not have a deductible at all for the year. No deductible at all, it said. And that's why the premium's a little bit higher per month. Now, as you can see, in January, you will avoid having to pay that $527 for the Eliquis. It's just a $47 copayment because there's no deductible on any tiers with this plan, hence why the cost is a lot more per month. Same concept though, as we get into September, we then get into the donut hole, where we were paying a $47 copay in January for the medication and throughout the year. In September, that then changes and comes back to the $134.85. Because you're in the coverage gap, it's going to be covered the same way once you get into that coverage gap, no matter which plan you pick. So the biggest difference if you're going into the coverage gap is going to be what your cost is up front and how the plan works up front, whether you're paying a higher premium and having no deductible, or whether you're paying a lower premium and having a higher cost in January with that deductible on the tier 3, 4, or 5 medications. With this plan, we can then go back to plan details if we think this is a good fit, and we can scroll down to the bottom. We can see which pharmacies take this plan. And here you'll notice that you'll have a bunch of pharmacies that are in either blue or green. As long as your pharmacy is in green, it'll work with the plan as a preferred pharmacy. The blue ones, again, you can go to, but you will pay a higher copay for going to those pharmacies. So let's say that this has our pharmacy in the network and we like the CVS pharmacy. You don't need to actually click on any of them. You can actually just go back to the plan that we want. And we're going to scroll up to the top, and let's say we want the SilverScript Plus plan. This is the plan we think is a good fit. We're going to hit Add to Cart, and then we're going to hit Continue to Apply, and this pop-up will come up saying that we're going to be directed to the form to enroll. And the reason I had you hit create an account at the beginning of the the video here is that it's going to pre-populate all of your information in here, so you won't have to type it in again. But here you should have your name, and then your date of birth will get entered in here, gender, and optional information, our phone number, address must be entered, so we'll say 100 Main Street. And then if you have a different mailing address, you can put that in here as well, and we'll hit next once that's filled out. And then here's where you're going to enter your Medicare information. You're going to omit any type of dashes within the card. So for example, if this was our number, when we type it in here, we're just going to type in the numbers and letters without the dashes entered in there, just as you can see here. For the Part A effective date, it's important that you follow this format: 2 digits, backslash, 2 digits, backslash, 4 digits. So for example, 01/01/2021. Whatever your Part A or Part B effective date is will be what you enter in this section here. Now, if you're doing this during your annual enrollment window between October 15th and December 7th, that is a automatic eligibility during that time, and the change will happen for January 1st, 2022 to date this video, or January 1st of whatever year you're enrolling. There is also this section down below, and this section is if you had a special enrollment period. So if you were doing this outside of the annual enrollment period, you would be looking for your qualifying event, whether you're new to Medicare, whether you were coming off of a work plan and now you're eligible to start your Part B of Medicare and start getting a prescription drug plan. This would be more of a special enrollment period. For most of you folks that are doing this between October 15th and December 7th and looking to make a plan change for the new year, you do not need to check off any of these boxes. Just leave them completely blank. What we'll do is we'll then scroll down here. We'll leave prescription drug coverage, no. We don't get any other benefits. Long-term care, no. Here you're able to check off how you'd like to receive your documents. I always recommend getting them in the mail. And then requested effective date will be the 1st of January during your annual enrollment period. If you were applying outside of that window, here is where you would pick when you needed the plan to begin. Again, for those applying during the annual enrollment window, October 15th through December 7th, your default start date will be for January 1st. We will then hit next again. Here it will bring us to how we want to pay for the plan. So there's a couple of different options. A bill can be received. You can pay with a bank account, EFT, coming out of your bank account each month, or you can have it deducted if you're receiving Social Security from your Social Security. If you choose to do the Social Security deduction, you will have to pick which benefit you're eligible for, whether it's regular Social Security or railroad retirement. On the EFT section, this is where you'll enter your routing, account number, checking or savings, whatever account you're going to use, authorizing that, and then hitting next. For today's purposes, we're going to put receive a bill, and we're going to hit next. Here is where you'll have a summary of everything, your contact information tab, benefit information tab for you to review if you'd like, and you're going to end up scrolling all the way down to the bottom after reading through these disclosures if you'd like. And we're going to check off this box that says I have read and agreed to the Aetna Medicare terms and conditions. I am the person listed on this enrollment form, will already be pre-checked for you. And then once you click submit, it will bring you to a new screen, and I'm not going to do that just now because I don't want to enroll this person into a plan, but it will show you the plan on the right hand side. The next screen will say congratulations, you have submitted your application with the link to a PDF of the application, so you can save that if you'd like. And then in about 2 weeks from completing this, you will receive your actual policy documents from the Part D prescription drug plan. Your new ID card comes to you at that point, as well as the policy information. And that is how you shop your prescription drug plan. Again, if you have any questions, you're always welcome to reach out to us. My contact information is listed at the top here as well. In case you don't have it, you can always reach out and ask any questions you may have. And again, if you're able to create an account when you logged in at the beginning of the video, next year when you come to search this, all of your prescription drugs will be saved, and then you can just edit whatever you need to for that new calendar year. Hope this was helpful in helping you learn how to shop your prescription drug plan. And again, if you have any questions, feel free to give us a call.